Dear colleagues, I show you a disease group you might never have heard about. Swiss cheese disease. P.P. Rosen, Peter Paul Rosen, famous, excellent pathologist in New York Memorial Kettering Hospital, 1980, wrote an article. The title of the article was Juvenile papillomatosis. The subtitle of the article was Swiss cheese disease. Listen to this story. She's 24, just delivered a baby. She has a self-detected heart tumor, warning signal, right breast, upper outer quadrant. The father's mother had breast cancer when she was very young, died from it 20 years later. You palpate and comes the second warning signal. There is a hard tumor. I just refuse thinking about cancer. I'm going to do everything in order to arrive at the correct diagnosis. Could you think about something benign that mimics breast cancer in this young woman? Mammography doesn't help you. Here is the palpable lesion. Doesn't want to go away. It's not really a circular lesion. It's not really a stellate lesion, but it has these funny calcifications. What is this? If you say architectural distortion, then it's palpable. You must think about cancer. I refuse. And then I started to smile. I turned to ultrasound and I say, we got it. This cannot be a carcinoma. It cannot be a radius scar either. But there is one thing I'd like you to think about, and this is called focal fibrocystic change, full of fluid, juvenile papillomatosis, wrong name, Swiss cheese disease, absolutely perfect name. I'm going to tell you why. You go to the grocery store because you want to buy really high quality cheese, because you want to have cheese fondue. And then you look for Swiss cheese, which is famous about its big holes. What's in the hole? Fluid, of course. That's why the name Swiss cheese disease. Isn't that very much like this? This is really for 3D. And then when the colleague who signed it out as cancer, look at what Laszlo says. It's not. Look at this. Wash out. I don't care. Forget about MR. Ultrasound is the king. Okay, we shall see. This walks like, talks like a cancer. I don't care. Because it's a young woman whose hyperplastic breast change is very active. So there is high metabolism here. MR is specific for anything that proliferates, a functional imaging method. And I'm ready to shoot 2, 3, 4 times. I wrote on the request for a pathology examination, that is a core biopsy histology, is this Swiss cheese disease? ? In 24 hours, I got the answer back. You're absolutely right, this is Swiss cheese disease. Dear colleagues, look at this. The rest of the tissue is normal. So anything that is here is localized to an area. What dominates the picture is the holes. The holes. This is the cheese, and this is the hole in the cheese. Look at that. Swiss cheese disease, I'm not saying this is the little brother of radius scar. No. It is one of the hyperplastic breast changes and the most frequently occurring. This is fibrocystic change. But for a funny reason, it is localized, not here and there, as in every other woman's breast. No, this is focal fibrocystic change. Of course, it's going to be palpable because fluid is not compressible. Too many cystic cavities, too close to each other. And of course, there is hyperplasia, but this is not cancer, not even atypia. Be careful with the word papillomatosis. In America, papillomatosis means several cell layers in this kind of proliferation. In Europe, you would think about multiple papillomas. So be careful with the terms. Anyway, focal fibrocystic change, you see the background red or yellow, that's the fibrosis and the cysts. And you can slice and dice, it doesn't matter, it's benign. Dear colleagues, nothing beats 3D. This is the 24-year-old woman's breast. She finished nursing about 6 months earlier. So this is an arresting phase, very normal. And this is very localized. Let's see a larger magnification. There we go. This is Swiss cheese disease. If you think it's rarely seen, anything you don't know about is rarely seen. As soon as you know about this, you're going to make the diagnosis. Juvenile papillomatosis. And as I mentioned to you, 1980, that Peter Power Rosen described it. Then he turned to his colleagues in the world, and by 95, he already had 500 cases. And I think there is an update from 2016 as well. Here is the story for you. P.P. Rosen, as we called him. 1993 in surgical oncology clinics of North America, January, he had an update, and that time he had already 500 cases. Dear colleagues, here is the story, clinical and epidemiology. In 100% of the cases, there is palpable lesion. Do you see this like this? I'm going to tell you another trick here. 1 to 8 centimeter. Yeah, could be. Nipple discharge can happen, but it's uncommon. Pain? Never. These are very young. And because there is epithelial cell proliferation on the step wedge, and these women have another expected length of life of about 60-65 years, you have to eliminate that epithelial cell proliferation. Every second woman had female relatives who had breast cancer just like this one. There is a blend of different hyperplastic breast changes like papilloma, fibrocystic change, apochromatoplasia, and so on. Just in order for you to remember, I show you a few more. When she was much younger, we saw the snakes. I'd like to mention to you something. The physical examiner might have the impression that he's having or she's having rosary beads, like the people who are praying, one pea-sized heart something and another pea-sized in a row, like rosary beads. I'm trying to tell you a lot of important clinical physical examination findings as well. And you do the ultrasound and you don't hesitate to say that there is something inside. Is it papilloma or not? I'm not going to hesitate to do the core biopsy. And it gave you grade 1 DAB. I knew it's going to be a duct, but I didn't know what it was in. So wide excision took place. I always criticized the too small size of the specimen. So they left some of the tissue behind because the duct went all the way here. See? And here as well. This is wonderful. This is what the surgeon could see. Somebody cuts through, and you see this very viscous, kind of a goo inside here, like this, very viscous. Beautiful comparison with mammography. And here is my 3D. Enjoy. Dear colleagues, Swiss cheese disease, right in front of you. Case number 2. What is this and what is that? Well, not my job. I saw it on the ultrasound. Pathologists have to decide. It's papilloma. And this one is papilloma. But what is here? This requires a lot of work. And what is this? Well, these are cancer cells, micropapillary cribriform, producing fluid. Look at that. But grade 1. And in the stroma, there was a calcification. And here is the amyloid body. Wonderful. There was no sign of invasive AAV. Another Swiss cheese disease. She went to the gynecologist and they felt something where? Anywhere. Here, on that line. And it was actually somewhere close to the chest wall. Palpable architectural distortion. We don't like it. Look how close to the chest wall it is. Acute angle. Fine needle aspiration and core. Pathologist immediately stops you. Be careful, this is not malignant. Not? No, it's hyperplasia. Then we operate. If it was malignant, then we would operate. Palpable architectural distortion has to come out. Look at this Swiss cheese. If you ever seen nice Swiss cheese in your life, when I'm using the word cheese, this is fibrosis and you don't know what's in it. Well, actually, cell proliferation among the cysts. A lot of cell proliferation, a lot of headache for a pathologist. Dear colleagues, this is Swiss cheese disease. Juvenile papillomatosis. We need a good pathologist to say whether this is just hyperplasia or cancer. Uncertain premalignant potential. It can cause discharge, 28-year-old. Here is the rosary beads. This was palpable. And when a young woman's circular lesion is calcified, don't think about fibroadenoma. It must be papilloma. And there we go. The whole lobe has to go. Very lobulated. Don't be afraid of the calcifications. These are in papilloma. I just told you. Fibrocystic change, fibroadenoma, papilloma. Crossstone-like calcifications. Juvenile papillomatosis, Swiss cheese disease, apocrine metaplasia, sweating, as you see here. Wonderful snouts producing the fluid. No atypia. 36 years later, still asymptomatic, but we called her back from screening. 32 years later, she looked like this. Has it regrown or they left half of it behind? It's a very benign lesion. In this case, just hyalinizes more. This is not the nipple. The nipple is here. What would you do now? You use the tools we didn't have 32 years ago. So now, here is the discharge. Once again, bumpy, hyalinized. And then you do galactography. And the disease is here. Juvenile papillomatosis. No malignancy. 14 years after surgery, she's asymptomatic and fine. Never forget this case. There was a serious nipple discharge, and the surgeon did the surgery polyclinically, and we were very close, so he called me over. We palpated hard, calcified papillomas and juvenile papillomatosis. That's why it was palpable.